We appreciate all of you taking time to come today and hear a little bit more about the Master Plan for Aging and some of the activities that we have going on. So I'm just going to ask everyone to take a seat. And if you'll just come to the front of the room, we are going to have a little discussion between a couple of people. So if you'll just come to the front, that would be terrific. For those of you who don't know me, I'm Jeannie Carter-Martin. I'm the president and CEO of Leading Age California. And we have, at the meeting this year, we have about 450 California members who will be here. So we're so excited that you are representing your communities and our membership throughout the conference. I also want to recognize our board member, Roberta Jacobson, who's from Front Porch. Thank you. And we also have several former board members, and I'm sorry, David Reimer is also a board member here in front. Sorry, David. And we also have a few former board members as well. And we're excited to have new and old representatives of our communities. So what we wanted to do today was give you a little idea about the Master Plan for Aging and the work of the various committees related to the Master Plan for Aging. But most importantly, the goal of this discussion is to get input from you about what you're looking for from your perspective, so that I can be a messenger to a degree for you as we take information and start to tease out different information. So we're going to give you a little bit of an overview of the Master Plan for Aging. We're going to talk a little bit about where we are with long-term services and supports, financing, and activities. We're going to show you a very short video, it's about 6 minutes, from the SCAN Foundation. Have you do a small group exercise together, just pair up to the person next to you, and then a large group discussion. So we're going to move pretty quickly through this hour because we wish we had more time, but we know that this will probably be just enough. So the theme of the Master Plan for Aging is Together We Engage. There is a website that is the Master Plan for Aging website, where all the information is about the Master Plan for Aging, the executive order, the committees and subcommittees, when the meetings are, how you can access the meetings, how you can listen in, and how you can participate. So first of all, the Master Plan for Aging was an executive order signed by Governor Newsom on June 10th to create a Master Plan for Aging in the state. And although we have other master plans for aging, we don't have other plans that are master plans. We don't have a master plan for aging, as other states do. Some other states have master plans for aging that have served as a roadmap for the integration, coordination, and collaboration of services across a very diverse constituency. The goal is that by October 1 of 2020, the Master Plan for Aging will be developed and it will be issued. The Master Plan is a roadmap, essentially, for a 10-year trajectory of activities that will, some start in 2021, and others will evolve over the course of that 10-year period. So in other words, we can't build a stadium in a day. We've got to work towards getting there. The master plan called for a couple of things. It called for a Master Plan for Aging Stakeholder Advisory Committee, which is the advisory committee to a cabinet level, meaning staff level committee. So the cabinet is an internal group of people that represent various agencies and departments in Sacramento. The subcommittees are all made up of individuals who are outside the staff level of the government. So in essence, pulling from various aspects. As you'll see on the next slide, I fortunately was asked to sit on the Master Plan for Aging Stakeholder Advisory Committee, which is representative of about 34 individuals across the state. There also were two subcommittees that were identified. One is the Research Subcommittee, and one is the Long-Term Services and Support Subcommittee, not long-term care, but Long-Term Services and Support Subcommittee. Those two committees are made up somewhat of the stakeholder advisory committees and also of other constituents. And within the context of each of those committees, those subcommittees, there will be burst task forces to address a particular issue. So an example might be, let's just say transportation. How are we going to address the accessibility needs for transportation as an issue? So there might be a committee made up of a whole different set of people to serve on that burst task force. So as you can see, there are various elements of the master plan planning process. There's a staff level, cabinet level task force. There's the Master Plan for Aging Stakeholder Advisory Committee. Then there are the two subcommittees that were actually identified in the executive order. I also fortunately got appointed to the research subcommittee, and we have Jed Hampton, who you'll also be hearing from, is sort of an expert witness, if you will, an expert to the long-term services and support subcommittee, even though he's not directly on that committee. And I'll introduce Jed in just a few minutes because he is the guru for long-term services and supports in Sacramento. The first advisory committee meeting that kicked off all of the activities of the executive order was on September 17th. So as you can see, it's just a few weeks ago. We haven't been in this process for very long. We don't have all the answers yet. These are lists of the stakeholder advisory committee members, and that's just my name highlighted. But importantly, there are representatives from across the state and also across diverse constituents. So as you can imagine, we wanted at least 4 or 5 members on that stakeholder advisory committee. But we weren't able to get 3 or 4 on that committee because of the diversity of the issues across the state. So there are hospital representatives, there are university representatives, there happen to be 3 provider representatives, of which we're one. We also have CAP, which represents skilled nursing facilities, and CalPACE, which represents the PACE organization. So we're excited to be representing providers in such a big issue for our state. The Master Plan for Aging also is complementing other statewide efforts, and this is just a description of some of those efforts. The governor also signed an executive order to appoint an Alzheimer's Prevention and Preparedness Committee, and as all of you know, 1 in 2 people over 85 will have some level of dementia, and we think that number is even accelerating. There's also the California Advancing and Innovating Medi-Cal, et cetera. I won't read through all of those, but the point of this slide is just to say it's not just the Master Plan for Aging starting out without any roadmap at all. It's looking at some of the work of other committees that have already advanced issues in the state so that we can build from where they have already, maybe the path they've already paved for us. The overall approach is that we will review these other efforts in California so that we're not starting from zero, we're not recreating the wheel. We want to leverage some of the existing programs in California and also recognize that we need to think differently about how we provide and coordinate and access all of the programs that we have in the state now. We want to partner with complementary state efforts. Last week at the research subcommittee, we heard some people from other departments that have already done incredible work related to planning for the state and have a lot of data that's relevant to the work that we'll be doing for the master plan. We are also learning from master plan efforts in other states. So a few other states have master plans, and so we're trying to look at what were the salient points from those plans, and also how can we integrate some of their ideas and accelerate some of the work that we're doing here in the state. We also are going to be holding regional events, tribal forums, and getting public input, and those already have started. The SCAN Foundation has taken a leadership role in holding public forums around the state. So if there is one in your community, it's an opportunity not only for you to participate, but your residents to participate, your staff to participate, your friends to participate, so that you have a voice in what's being developed at the state level. The Stakeholder Advisory Committee is an advisory committee. We're not a governing body, but we're advisory. So we will be reviewing draft plans and making recommendations and suggestions. And I will say that to date, in the several meetings that I've participated in, the staff at the state level have been very engaged in the comments and have, at subsequent meetings, integrated feedback right away. So it does appear that everyone is listening to the complexity of what we're trying to do in the state. This is the overall timeline. Again, all this information is available on the Master Plan for Aging website. So if you don't quite get this, you're welcome to just go to their website. We're going to be this year finalizing the framework, which is a big task. Everyone has their own opinion, and everyone has their own perspective, and everyone has their own need to integrate a certain element of aging services, aging accessibility, disparity issues, etc. By the spring, we'll be developing deliverables. We'll be providing the long-term, I have no idea, I must have been asleep when I wrote this, long-term services and supports report to the governor. In the summer next year, we'll be completing the draft deliverables, giving it to the cabinet to review, and then in the fall, we'll release the master plan, and that will be technically by October 1. And the pace at which these meetings are occurring, it appears that that actually will occur. Some of the deliverables are, as I mentioned, a roadmap. So when I think of a roadmap, I think of a map that we all used to have on paper, where if you needed to get from here to there often were several roads to take. And so I imagine that in the master plan, there will be a master plan that will appeal to you, or to you, or to you. So the master plan may have different elements to get you to the needs that you have. There will be a blueprint also for local communities, and we're talking about accessibility related to the blueprint for local communities, because it's not legislated, it's not mandated. It really has to be up to a local community to decide that they're going to implement certain elements. There will be a resource toolkit, a data dashboard, and then a long-term services and support report. The SCAN Foundation, as I mentioned, has done a lot of work on the Master Plan for Aging and has tried to provide some framework as we all think about the master plan. We're going to be talking about these a little bit more in a few minutes in a small group exercise. They've tried to frame this in 3 areas. So first, a physical environment. What is it that older adults need? What is it that we need as we age over a lifespan in terms of our living environments? And I'll talk about some of our priorities at Leading Age California in a few minutes. It's also about supportive services. What kind of services must be available and should be available, and then how will people access those services, both not just from a physical accessibility standpoint, but also financially. And then finally, social and emotional well-being, sort of the healthy communities, how will we approach that? So thinking of that framework, the cabinet, the staff, drafted some initial goals. And the initial goals have been modified, and I'm assuming that with each conversation that we have, these goals will continue to be modified a little bit more until they're refined to address the full scope of the roadmap. So there are 4 goals. The first goal is we will be able to live where we choose as we age and have the help we and our families need to do so. The second goal is we will live and be engaged in age-friendly communities. The third is we will maintain our health and well-being as we age. And the fourth is we will have economic security and be safe from abuse, neglect, and exploitation throughout our lives. Those are very broad goals, and yet what we're trying to do is address what the needs of many different kinds of individuals and communities have across the state. So these are the draft goals. If you have input during our discussion, we would love to have your input on these goals. And again, I'll take that and be a messenger for you. I don't know what will change. I don't know what will be incorporated or not. So just so you know, we'll think about those goals in a little while. So some of our goals and some of our, I should say, our messaging that we're trying to bring to the table are around senior affordable housing. As many of you know, the largest constituent of members in California at leading age is senior affordable housing. That's the largest representation that we have. Within senior affordable housing is a whole set of complex issues related to affordable housing. One is how services, both service-enriched housing exists, as well as home and community-based services, home health, hospice, personal care assistance in those settings. We also are very much engaged on the long-term services and support issue, and Jed will be talking about that in just a moment. We want to influence how our colleagues on the committees think about workforce, because we know that workforce in any industry right now is diminishing, and so what we're trying to do is influence how will we attract people into the spectrum of coordinated care that we have in our member communities, whether it's senior affordable housing or whether it's in our retirement communities, our life plan communities. The next bullet is technology. I mentioned that we are hoping to decrease disparities in accessing various elements of the plan, care coordination, and then we're looking for your input on either these or what else do we need. So with that, I'm going to ask Jed to talk for a few minutes about long-term services and supports, and then we'll have a video and then a brief conversation with all of you.
Great, thank you very much, Sheenie. Appreciate it. My name is Jed Hampton. I'm the Director of Public Policy here at Leading Age California. I see many friendly and recognizable faces. It's so good to see everybody. I just wanted to touch real briefly on specifically the work that we're doing around long-term services and supports financing. Many of you are probably pretty well aware that the Leading Age California, in partnership with Leading Age National, have been looking at ways to finance long-term services and supports in different aspects. And we've been involved in this work for many, many years. Specifically here in California, we've been heavily engaged in this conversation for about the past 5 years. Most recently, about 2.5 years ago, Leading Age California became a founding member of an organization called the California Aging and Disability Alliance. The California Aging and Disability Alliance, or CADA as we call it, has 21 different organizations throughout the state that make up different representation from provider associations, consumer groups, unions, and other interested stakeholders, really focused on a California-specific benefit that will help individuals pay for long-term services and supports outside of the current structure. We've been meeting bi-weekly for, again, approximately 2.5 years, and about 2 years ago, we introduced ourselves to the relevant policy makers and stakeholders in Sacramento by working on a budget proposal that would be approximately $3 million to collect long-term services and supports data throughout the state. Many of the stakeholders in this group who work in the space have long noticed that California, as well as we do robust data collection, there's not a whole lot of data around long-term services and supports. Specifically, who's utilizing these supports, who's providing these supports, what is the unmet need, who would be eligible for a need but doesn't have the available resources available to them, a variety of different factors. So 2 years ago, we worked to introduce a budget proposal, again, for $3 million that would include a series of long-term services and supports related questions in the California Health Interview Survey, which is really the largest health interview survey, state interview survey in the country. We were pleased that that was included in the budget last year and has already gone underway, and that data is currently being collected and analyzed. And we anticipate that the first round of the survey data will be released sometime in early 2021. So we're very excited about that. And that really was a way to, again, kind of introduce our organization to the world, say this is an issue that we think is critical to meet the needs of all Californians, and we're ready to move forward. So this year, we took it one step further and decided to be a bit more bold, and again asked for another budget proposal of approximately $1 million to collect, to do a actuarial and feasibility study on a California state-specific benefit for individuals to pay for long-term services and supports. Once again, we lobbied very hard to get this included in the budget and through various stakeholder meetings with the administration, with legislators and their staff. And we're once again pleased to see that the budget, the governor did decide to include that $1 million in his final budget proposal. So that actuarial study is just starting to get underway. The administration has chosen Milliman, which is a national actuarial firm, to conduct the analysis. And currently, CADA is working with Milliman to kind of tee up what that actuarial study is going to measure, including eligibility levels, age restrictions, activities of daily living thresholds, a whole variety of elements that go into the development of an actuarial study. We do anticipate that the actuarial study will be complete and analyzed by right around the time the Master Plan for Aging Stakeholder Advisory Group wraps up their work in October of 2020, which perfectly sets the stage for 2021 as being a major push towards the implementation of a Master Plan for Aging. We are very optimistic that a long-term services and supports benefit might be included in the implementation of a master plan. We also introduced a legislative bill this year, Senate Bill 512, that was authored by Dr. Richard Pan in the Sacramento area, that would have set up a framework for what that benefit would look like here in California. So essentially what this bill would do is it would set up a long-term services and supports advisory committee, similar to the Stakeholder Advisory Committee that Deanie currently sits on, that would help inform the administration of what the benefit in California might look like. It also would have set up a long-term services and supports benefit fund for which money would be deposited into the fund and then appropriated accordingly to help fund the benefit. Our group was very strategic in not including the funding mechanism specifically in the bill, because as we all know that's always the most controversial piece is how are we going to pay for it. So we did that strategically, and we really utilized this bill to bring this issue to light to all the legislators in Sacramento and their staff. We were pleased that the bill was very popular, did not receive a no vote. It made it all the way through the Senate and into the Assembly. And right around the time it made it into the Assembly is when Governor Newsom announced his Master Plan for Aging executive order. So it kind of put the brakes on that just a little bit because the administration had communicated to us that they would like to see this process thoughtfully considered during the Master Plan for Aging discussions. So we decided not to move forward with the bill this year and let the Master Plan for Aging process play out. And so really it's a convergence here in October of next year where we'll see the actuarial study that we passed in the budget be completed. We'll see all of the great work that the Master Plan for Aging Stakeholder Advisory Committee group has done. And it really sets the stage nicely for again, 2021 when the legislature reconvenes. So that's kind of where we're at when it comes to long-term services and supports financing here in California.
Great, thank you, Jed. And I just want to, we should all give Jed a big round of applause for getting such recognition and notoriety for the system. It's hard to imagine the kind of work that goes into it, but he's really been a pace setter in Sacramento on this issue. I know there are a lot of a lot of discussion elements that you want to have and you want to tell us about. So we're going to show this video, and I'm going to tee it up, and then I think we're going to change that exercise, Jed, so we're not going to hand this out. So this is a 6-minute video that was put together by the SCAN Foundation. And the SCAN Foundation, as I mentioned, has been also very important in helping to frame some of the considerations and discussions. You can go to the SCAN Foundation website and find all of these materials related to the Master Plan for Aging. And I would encourage you, when you go back to your own communities or your own situations, your own organizations, that you ask your staff to participate in some of the exercises that the Master Plan for Aging from the SCAN Foundation site has created, and we'll give you some of those materials before you leave so you can get an idea of what we have. So let me just tee up this, let's just show this one video. It is one of 3 videos related to the Master Plan for Aging approach that SCAN has encouraged us all to think about. And this particular one is starting to think about the social and the physical environment of individuals as they age.
The physical environment. The physical places older adults and people with disabilities live in matter. They can be supportive, providing safe and easy access to food, transportation, healthcare, and encouraging social interactions. Or they can be withering, limiting their mobility, social connectivity, and overall well-being. Let's take a deeper look into different aspects of the physical environment and the impact they have on older adults and people with disabilities. The well-being of older adults and people with disabilities can become compromised when they're not able to access basic needs and amenities due to a lack of transportation options that are safe, reliable, flexible, and/or affordable. And as someone gets older, their ability to get around on their own often becomes even more restricted, while their reliance on family, friends, neighbors, and social services to get around increases. This transition is often more than logistic, it's emotional. When mobility is lost or reduced for older adults and people with disabilities, there is also a profound loss of their independence.
We don't have enough. I mean, thousands of people need rides every week to get to physical therapy and dialysis. I mean, we have very few buses that run on a timely basis through our community, and seniors are just desperate to get to, the store, appointments, friends, family. They're trapped.
I was checking the other day that the bus in advance you can call, they will take you from this place, setting up a date, a time. It is not cheap for me. $8 round trip. With $8 I go buy breakfast for 2 days.
I can only walk by a walk. I have stop and rest. If I walk to the bus stop, it's about 8 blocks from here. So I have to stop there about 8 times or this.
Housing is another key aspect of the physical environment. The need for high quality, accessible, and affordable housing is dire. Those who have it struggle to keep it. Those who don't have it search and wait for years. And navigating confusing housing rules and lengthy processes is so arduous that even social service providers have difficulty. Another critical housing-related concern is that homelessness among the older adult population in California is on the rise, in large part due to the housing affordability crisis. Homelessness is not solved simply by providing a roof over one's head, though it is a good place to start.
I'll tell you one thing, we need to get affordable housing. They don't have it around here. I mean, this apartment that I have is supposed to be the lowest price one in Orange County. And it's $1,200 something a month. That is not reasonable. It's a studio.
The loops that I had to hop through to get into the apartment, they had you go over here to get your information right here, and then had you, a few days or a few weeks later, then you had to go over to another city to get this information over here. Then you had to bring it back over here to the 3rd office, and then the 4th office. It was like running track. It wasn't easy at all, in no shape or form. It was because I was a former real estate broker that I could kind of analyze and figure it out.
And it's
It's just basically addressing every veteran's need, addressing the housing barriers that have prevented them from housing, whether that be financial, medical, mental health, substance abuse. We kind of try to fix all of that.
Everyone is just throwing money, they're throwing food, or, even when you put them into a shelter, that's great. But what happens after that? There needs to be a transition out. That's the point of our program here.
Lastly, another often unpublicized aspect of the physical environment is the proximity to toxic conditions. Living close to major polluters can affect everyone's health, but older adults are particularly vulnerable to the health implications.
I used to be pretty good.
I was in the medical field, and the doctor said they never saw so much strep throat, they never saw so much, so many sinus problems as we have here. The problem is the damage is done because the dust is already here, it's covering all the ground. We still have really unhealthy air. We've all been drinking the water that's causing cancer in us, generations.
Great, so this is just one example of the kind of information that we're looking at. So this is the physical environment. There also is a similar video on the SCAN Foundation website about social and emotional well-being. And the other one is about, can you show me the other one, Jennifer? The supportive services. So you can see there's so many diverse issues, and I think that the representation on the Stakeholder Advisory Committee is diverse. It represents a broad spectrum of age groups, a broad spectrum of different individuals in our communities, etc. So although it's not perfect, I think we have tried to pull together groups that will tease out almost every issue that we have. So what we wanted to do was, for just about 5 minutes, have you turn, if you'll just put back the goals up first, if you'll turn to your neighbor, and as you think about the goal, our goals, right here, this one, if you think about our goals, what are some of the additional goals that you want to make sure that we incorporate into the master plan? And I would like one or the other of you to take notes, if you could. We won't have time to hear from all of you. And then just turn them into Eric Downey, who's right here in the front of the room. So if somebody would, it doesn't have to be fancy notes, just scratch notes so we don't lose a thought. So just spend about 5 minutes with your neighbor, and then we'll stop and we're going to have an open discussion. Thank you.
Eric, are you participating? I'm going to hang. You're going to hang. I'm David. Where are you from? How far away from you?
No, I went to UC Davis, but she's in Sacramento.
I'm Melinda.
All right. Cool. Well, you're big into this. What's the statistics of how many nurses are retiring versus graduating? I've heard it. I didn't even believe it. It's crazy.
There's big, and it really stand it. Yeah, right. Yeah, right just on the street. Yeah. When I look at this, looking across all of them, one piece that comes to my mind is value. How do you achieve all of these with a goal of how we organize because you can make control. But that might be a sub-goal that supports all of these rather than the plan.
Well, I have aging parents. My father married in February. My mom is still in a nursing home. And what I've observed the last 5 years is that they have very unrealistic expectations of where they're at and what it is they need.
And I can imagine she does it so well. You're right.
Yeah.
So when you think about this, part of it's that you're coordinating transitions.
One of the other goals was written was we want to live where we want to live. Well, my mom and dad, they were on first name basis with every EMT in the county. They just kept following.
There's a lot of discussion about people, I'd rather stay in my phone calls than That's a really good point, thinking about how that fits. These seem like these are separate.
Well, I was thinking maybe they both should be, we want to have the programs and facilities present for them to choose. So my mom should be told, think again, not because there isn't any space available where she wants to live, but that she's not able to physically function.
All that.
You're coming up with these rather stiff-sounding terms like functionally appropriate. I mean, that sounds terrible.
Then you get to the balancing of that side.
Well, finally they break bones and they go to the hospital. And they're stuck in a skilled nursing bed for months.
You went back to that school and said letting them decide where, and it said how to support services to support them with those choices. So would that mean having people coming into it regularly, supporting the family and the older adults, that some people don't even want to?
Right.
No, I agree with that too. I feel like this list covers at a very high level, but in each domain area. So I think some of the things we're talking about really would be
UC Davis, you have a BSN, so you graduate with?
We don't. We have a master's in engineering nursing. We originally went to school only 10 years ago. We started with a PhD and master's in leadership. And we added, we have nurse practitioner, PA, physician assistants, and also now the most recent is a master's in engineering.
Okay, well, I know how 5 minutes goes really fast. And it's been 5 minutes, so. Okay, I'm gonna ask you, I'm gonna call you back to attention and would love to hear your thoughts and comments. Our videographer and COO, Eric Downey, who I think all of you know, is, Eric is posting this on Facebook Live right now, so we have an audience listening in, which I forgot to announce earlier. So if you will share your comments and any other comments you'd like to make in the common group, we have a microphone, which would be great if you walk to the microphone so that we can hear you well enough, and also so our listeners can also hear. And if you don't want to be videoed, Eric can just turn his camera back to us.
What's the matter, right?
You know, I just came with this thought after we stopped talking, but our group had a couple of additional goals, and I think that the upstart of it is to decrease social isolation. And when some transportation is an issue, and intergenerational efforts would be a real plus. And and then personally, I just wanted to add in about disparities, including the rural disparities, because the rural areas have a high percentage of poverty, have a high percentage of older people, have and lack transportation and facilities, unfortunately sometimes the state allocates funds on a per capita basis, and so Alpine County gets, you know, like they have like, I don't know, a couple thousand people. They don't get enough to even support an infrastructure. So what they've been adopting a floor or you know, a basic allocation, and then on top of that, a per capita. And that's really important for the 37 counties that have major rural areas.
Thank you. One of the things that has been done in the Master Plan for Aging is the Department of Finance has presented some of these disparities across the state already, and we're continuing to delve down into some of those disparities. So it's helpful to hear the reality in a rural county with very few people. Thank you.
excellent comments, by the way. I would just add that improving information and education to help seniors access the resources that are available. More often than not, we find that seniors don't even know what resources are available or how to access them or have accurate education or information about them. And the second comment was on technology. Technology is good, but it's only as good as the education, the information, and the assistance that's provided to back up any new technology or systems that are available. So education and information and communication on all these topics.
Great, thank you, Roberta.
Just to play off of that, key to that, to information sharing, is having a person's consent. Information sharing about the individual is absolutely key. Remote monitoring, all the sorts of things, telehealth we'd like to do, but we have to have the individual's permission to share that information. So education and awareness on consent management would be absolutely key to making this happen. That could, transfers all these areas, right? So I think sharing with our senior citizens that it's okay to consent to share your information, it's for your benefit to make that information available with your permission, but that education and universal consent, whether it be for housing or transportation, medical, substance abuse, mental health, is absolutely key.
Thank you. I don't think that issue has been discussed in any of the meetings that I've been in, so that's really helpful.
Happy to discuss more, but I run the Health Information Exchange in San Diego and Imperial counties, so happy to share more.
Thank you.
I thought I should add on to that because we were our own little group and we didn't follow the assignment because we've never really gotten together before and we had some great thinking, and so we started talking about the data and how you have your Social Security account from birth to death, but your medical information leaves you when you change providers, and that's been detrimental to the health in our country. We also talked about the fact that the huge bulk of cost goes for the health care of the elderly, sustaining life toward the end of life, and that isn't necessarily always needed. So we have things like the St. Paul's PACE program here in San Diego, which has done a very effective job of ameliorating aging, bringing down the cost. They operate about half the cost that it costs the Medi-Cal system to provide the same thing. And freeing up that kind of money is what it would take to fund all these pipe dreams. So if the master plan is going to be something more than just a bureaucratic exercise that puts down things that people in Sacramento think about, we have to really engage everybody. And I was talking to Jeannie before, we old folks like to say that if it's about us, then with us. So the fact that there's no old people on the stakeholders already has undermined the credibility. Now, the governor's executive order did say that older Californians should be included, but somehow that got lost along the way. So the California Senior Legislature, which is an official state agency that represents all of the elderly in the state through the area agencies on aging, is not represented. People like Laura Trejo, who's brilliant on creating age-friendly cities, is not represented. So I think that it really needs some work if this effort is going to have meaning and have a salutary outcome.
Thank you, Jack. You raised some really important comments, because I don't know what the right definition of old is, but there are a significant number of people on the task forces that I sit on that are over 65. So I don't know, again, what the threshold should be. But the other part, and this is, I think, so important for each of you to think about, you can listen into every meeting, and you also can provide input at every meeting and after. So if any of you are ever interested, or your friends or your residents, your staff. You can have a whole group meeting. You can have everyone listen in on your staff. You can have a resident meeting and have everyone listen in. And you as a group could submit a question during that call. So you also are invited to sit in the room. And the last 30 minutes of every meeting are for public comment. And that's where I think it's so important. At the research subcommittee, an individual brought up some issues at the very end of the meeting during public comment that I personally had never thought about before. So those are the kind of inputs that I think everyone appreciates and also likes. So hopefully from the standpoint of the spectrum of ages, we have identified people. But I want to also mention this huge cost. There's one item called no wrong door. And that idea and concept of no wrong door is somewhat addressing this issue. I don't know how it will be integrated ultimately, but that's accessibility to information across your lifespan.
Oh, I've been told to introduce myself.
Or ask.
I'm Leslie Moldow with Perkins Eastman. We're an architecture firm, but I represent a consortium of very brilliant
providers.
people. Yes, providers. We talked about home matching seniors who have resources in their homes with younger persons who need housing and can give support and pay. We talked about the needs of the middle income that really sincerely need to be addressed, and certainly homeless and low income are absolutely critical, but the vast majority of people fall in the middle, and I've been talking to quite a number of people. It's going to be a hard nut to solve. It's going to need some additional state strategies. Public transportation wasn't on the list, but in order for people to feel like they can be connected to their community, they have to be able to get easily to where they're going. So looking at different ways to arrange housing to be related to transit, which might include encouraging density so that you can provide services more cost effectively. Perhaps subsidizing the village movement, which is an amazing movement and fledgling and always trying to scrap itself together, but actually is amazing, organized in a lot of communities that could start to take on some more responsibility. And just streamlining some of the current bureaucracy would probably be welcomed by a lot of people in this room.
Administrative simplification.
Hi, we talked about a couple of things, sort of sub-elements with this and fit back to the goals. One was, I don't know if I can say this right, so help me out, reconciling or at least being aware of the gap that might be there between an older adult's choice and some functional care needs, and how to be available to support what might be that gap in where they think they are going to need the support and how to give that to them. Another might fall under care coordination, but across many with transitions of care, how to support the transitions from one setting to another if the aging in place isn't going to work out. And the other, building on what a couple people talked about, was value. How to be thinking about the long-term sustainability and the value in each of these areas and how that can be supporting the different goals.
Could you, Alina, before you sit down, could you talk a little bit more about gaps in choice and functional care needs? I'm not sure that I would be able to translate that.
I think it came up with an example of an individual who's, we talked about choice, and clearly people want to maybe stay in their own home. How do we best support them in their own home when the care needs are increasing? Am I explaining this right? But there might be some resistance. So how to support them in a very respectful, dignified way and let people make choices. Is that getting
You did well.
Good job.
Thank you.
Introduce ourselves. Laverne Joseph, the President and CEO of Retirement Housing Foundation. We're based in California, but we're working all over the country. And I think this study is tremendously important, but as someone who's been around for a few years, let me tell you that a long time ago, the federal government did a study on the need for affordable housing. I testified. They met all across the country, and I testified, I think it was down here in San Diego. And the study came out and talked about hundreds of thousands of units that were needed. And then it was delivered to Congress, and a book about that thick was on the bookshelves, and nothing ever happened. So I would hope that the governor and the folks who are working on this will not think that their work is done when they produce the study. We've got to produce the units. The government is not always run by logic. If it were, we wouldn't have an affordable housing need today, because affordable housing keeps people out of hospitals, and a couple of days in the hospital will cost more than an entire year's subsidy. But again, it's not run always logically. And some of you heard me say before, the problem is if it's a HUD project, the expenses on the discretionary side of the budget, HUD, the savings are on Health and Human Services, which is non-discretionary. And I've said for years that somehow we have to get these two departments working together to make a real difference in the lives of people.
Thank you, Laverne.
Hi. So I definitely agree with everything that's been said here. And I think a really important overlay on top of all of these goals is the idea of resiliency, and really creating a plan for providing each of these services and each of these ideas, but even in times of disaster and wildfires, earthquakes. I'm from the Bay Area, and last night my power went out, which for me and my boyfriend, it was fine. We just lit some candles and wrote it out and we're fine. But there are people that, they might not have had a generator to run their breathing machine, or they might not have been able to receive their prescriptions at the pharmacy before the power went out. So there's a very real need to continue providing those services even when the power goes out or with wildfires coming through. So I think that needs to be part of the discussion too.
Yeah, thank you so much. I'm glad you brought that up. At the research subcommittee that met last week, they said that an additional, I don't think they called it a goal, but piece of the plan is now going to be focused on disaster preparedness, which had not initially been incorporated. So thank you for bringing that up today. I also want to comment on Dr. Laverne Joseph, who just spoke, his comments. This is so critical, what you just said. The roadmap is intended to be actionable. And so what we've talked about internally is the opportunity to initiate, as Jed said earlier, there's been legislation on the table, or bills on the table, that haven't been passed because they've been now incorporated into the conversation about master plan for aging. But next year, after the work of the master plan stakeholder advisory group and the master plan is submitted, there now will be a whole new opportunity for shifting bills and legislation that will help it be more actionable in certain areas of the state where maybe there are fewer resources or other opportunities. So I think you made such critical comments about being actionable and not sitting on someone's shelf. That's absolutely critical. And I know we are bringing that message, and I think all of the members of the committee are bringing that message as well. I think we have time for one last comment, one last set of comments or questions.
I'll take another one if nobody else will stand up. I'm Ann Lindsay from Humboldt County, and I'm working on getting the senior life plan community going there. And what strikes me is under the long-term supportive services, there is no licensing for greenhouse like alternatives to skilled nursing in this state, and that's certainly more affordable and more, in many instances, more acceptable.
For those of our audience who don't know, do you want to talk a little bit about the greenhouse?
Yeah, and I don't know what the term, a greenhouse is a proprietary term, and so I don't know what to call it other than, it's more like a board and care or a home-like setting. It's not a medical model like a skilled nursing, and so there'll be a house set up and have 12 to 15 residents, and primarily run by nurses, aides, or non-professional staff, and as opposed to having a nursing station and all of that. It's more home-like, and it's many. I think at least 30 states all have them, and California's had 4 years ago or so. They started a program to allow people to develop, or 10 groups to develop it, and nothing happened. And maybe it was administratively too burdensome. I don't know what happened, but we should move forward.
Do you want to address that at all?
Again, Jed Hampton. Yeah, thank you for bringing that up. And you're right, we had a small house skilled nursing facility pilot program that was developed about 7 years ago. The Department of Public Health, California Department of Public Health, never got around to actually developing the regulations. There was legislation that was passed. It gave the department a 5-year opportunity to run a small house skilled nursing facility program here in California. On the building standard side of the house, which is overseen by OSHPD, the Office of Statewide Health Planning and Development, they developed building standards for the small house skilled nursing facility pilot. The Department of Public Health never developed the actual licensing regulations until the very last day of the 5-year opportunity in December of 2017. So they ended up renewing the skilled nursing facility pilot program for another 5 years. It exists through 2023. To our knowledge, no skilled nursing facilities have applied to do. One has applied.
And there's a whole story.
There is a caveat, which if you want to talk about after, I'm more than happy to talk. There is a caveat to that, but the program is available and the application process is available. We've talked with a few of our members about going through the application process, and I'm more than happy to help develop that as needed.
So we've been trying on these kinds of issues that are very successful outside of the state to bring them in-house and re-engage in conversations, and also where there are applications that have failed or not been successful, maybe is a better way to put it, to advocate on your behalf and or to understand what maybe some of your administrative burdens were or economic burdens were to moving forward. So we so appreciate, it's 4:45, feels like 4:45. It is 12:45, 15 minutes before the opening general session of the annual Leading Age Conference. And I so appreciate, and Jed and Eric, so appreciate all of you coming to this California discussion. This is really an opportunity for us, and we believe that the governor is dedicated to making this an actionable plan. He has, in his opening remarks as governor, in his opening remarks on the campaign trail, he mentioned housing, care, and services to older adults. So we feel that he is interested, so to speak, has our back, and we think we're all working very collaboratively together. So thank you again for your comments. At any point, email me, email Jed, email Eric, and we'll do the best we can to integrate these comments and any upcoming comments that you have. My one last thought is, if you are interested in re-engaging in this kind of a forum, we can plan these at our policy conference as well as at our annual meeting. So I'm seeing a lot of shaking of your heads. So we will see what we can do to have something at those two events. We try to do as much as we can when we already know you're going to be together. So thank you again, and I think head downstairs to the Leading Age opening general session. And tomorrow night at Stakeholder. Have a great day. Thank you. Sorry I interrupted your clapping. Go ahead and clap now.
Good to meet you.
We put all of this in foundation.